Hey everyone, it's Sarah with registerednursern.com, and in this video I want to be doing an NCLEX review over ulcerative colitis. And as always, in the YouTube description below or at the end of this video, you can access the review quiz that will test you on this condition. So let's get started. First, let's start out talking about what is ulcerative colitis. Ulcerative colitis is a type of inflammatory bowel disease that causes inflammation and ulcers in the inner lining of the colon and the rectum. So, this condition is going to be limited to your large intestine, your colon. And it's different than Crohn's. Crohn's is the other type of inflammatory bowel disease, and Crohn's can be throughout the GI tract, and it tends to affect the whole bowel wall. So ulcerative colitis is only going to affect the inner lining of the colon. So remember that so you don't get those two confused. Now, what can cause this condition? The exact cause is unknown, but it seems to be autoimmune, where the body is causing extreme inflammation in the inner lining of the colon. And it tends to be triggered by or aggravated by some environmental sources, like the person consumes a lot of fat in their diet, or they consume a lot of dairy products, or stress, or illness like bacterial or viral, or overusage of NSAIDs. Because these patients tend to have what are called flare-ups, where everything in that colon, depending on where their ulcerative colitis is at, becomes inflamed, it flares up, then they can go into remission, and these things tend to trigger that. And another big thing that plays a role in it is genetics. It tends to run in families. Now let's talk about the 4 different types of ulcerative colitis. But before we do that, let's look at the basic anatomy of the GI tract, because ulcerative colitis is limited to the large intestine, the colon. So you have the stomach, and then you have the small intestines, the duodenum, the jejunum, and the ileum. And the ileum leads into the colon, and it starts at the ascending colon, so food will shoot through there, go up the ascending colon, across the transverse, down into the descending, into the sigmoid, and then into the rectum. And remember, ulcerative colitis will start in the rectum, and depending on how severe the patient has it, this disease tends to start just migrating up through those large intestines. And it'll start here, and it'll just migrate together in like a uniform fashion, affecting all of the colon until it affects all of it. So let's talk about first the most mild type of ulcerative colitis. It's called ulcerative proctitis. Let the names help you, because it will tell you where the ulcerative colitis is at. So we have proctitis. Proctitis means inflammation of the rectum. So this type of colitis is limited to the rectum area. Then we have proctosigmoiditis. Again, let the name help you. Proct means rectum. Sigmoid means the sigmoid colon. So we have inflammation, because that's what itis means, of the rectum and the sigmoid colon. And this is a type of colitis that will affect the rectum and the sigmoid colon. Then we have another type called left-sided colitis, and it affects the left side of the colon. And thinking back to our anatomy part, what's on the left side? We have our rectum, our sigmoid colon, and our descending colon. So that's where that affects. Then we have the most severe case of all of ulcerative colitis, called pancolitis. Pan means all, and col means colon, so it's inflammation of the whole colon. So very severe patients, not doing good whenever they have this, and will affect the rectum, the sigmoid colon, the descending colon, the transverse colon, and the ascending colon. Now let's look what is happening in the large intestine whenever a person is having a flare-up with ulcerative colitis, along with these signs and symptoms. Because if you can see what is going on in those intestines, you can remember why this person is having these certain signs and symptoms. Okay, so we have a flare-up going on. We got some inflammation in this large intestine. Now, body does not like inflammation. So those cells that are lining that large intestine, when they become inflamed, they start to die. And when they die, they form these little ulcers. This is the big hallmark of this condition. So you're getting inflammation of that colon, you get some ulcers forming. And these ulcers will start to bleed and release pus and mucus. So this is where we're going to start getting some signs and symptoms, okay? The patient's going to have a fever. Why? Because we have an immune response going on, and how our body responds whenever we have some inflammation going on in the body, it increases our temperature to help with the immune response. We're also going to see some anemia, low red blood cells. Why? Because these ulcers are bleeding and releasing blood, so we're going to start losing blood. Also, the patient's diarrhea is going to have some blood and mucus and pus in it. Why? Well, whenever you have your contents going through your small intestines, it's liquid. And then it's going to hit this colon, and the colon is inflamed. And that stool is going to fly through there, and it's going to go over those ulcers, which is going to pick up that blood and mucus and pus. And whenever they have a bowel movement, they're going to see that their stool it's watery and it has blood and mucus in it. Also, the patient is going to have abdominal pain from those ulcers and that frequent diarrhea. They're going to be in really bad shape. Now, one thing, because this colon is inflamed, it can't do its job. And what does the colon do? The colon plays a huge role in absorbing water, because remember, the contents that enters into the colon is liquid, because the small intestine says, hey, the colon will deal with this water and absorb it. But the colon can't absorb it and absorb those minerals. So the patient is going to be having some dehydration, because they're going to have frequent bouts of diarrhea, and they're going to have some electrolyte imbalances. They're also going to have a decreased appetite. They're just not going to feel like eating. And this is going to lead to weight loss as well. Now, with Crohn's, you're going to see more weight loss, but with this, you will see weight loss too. Now, also, that inflammation, because the colon is so inflamed, it's going to cause that person to want to go to the bathroom urgently. They've got to get there fast, and they're going to have frequent bowel movements just because it's so irritated. So those are some other symptoms you will see. Now, to help you remember the signs and the symptoms of ulcerative colitis, remember the word ulcers, because that is a big thing we're dealing with this condition. Okay, so U for urgent bowel movements, L for low red blood cells, which is anemia, or they'll also have loss of weight. C for cramps in the abdomen. These are going to be very, very painful. E for electrolyte imbalance. The other E for elevated temperature. R for rectal bleeding, because the blood is leaving those ulcers, collecting in the rectum, and also the rectum can have ulcers in it and be irritated as well, so they can have that. And then S for severe diarrhea with the pus and the blood and the mucus. Now let's look at the complications that happens due to ulcerative colitis. We just seen what is happening to the large intestine during a flare-up, but what's going to happen whenever these keep happening over and over? Okay, so these patients will have the periods of the flare-ups. Then they'll have periods of remission where they won't have the signs and symptoms, and that allows that ulcerative site to heal. But then they have another flare-up, and then it heals. And that continuous cycle of healing ulcers is not good for the lining, and it can't handle this. So what starts to happen is that these little polyps will start to form, called pseudopolyps. They'll also get scar tissue, which in the end will lead to narrowing of the bowel. Now, with severe cases, like how we've seen with the pancolitis, the large intestine can actually start to lose that unique form that it has. And notice how it has these little pouch-like areas that give it the little curves to it. And those are known as your haustra. But what will happen is that over time, it will start to lose that look. So instead, it will start to look like a smooth organ. And the haustra help with churning your food, getting that food moving through the intestines, and it won't be able to do that properly. So whenever the patient has a barium enema, which is one of the ways they can diagnose this, the large intestine will start to appear as a smooth looking organ without those pouch-like areas, and it'll have like a lead pipe look to it called the lead pipe sign. So if you ever see that, that's what that is. Another thing that can happen is that the large intestine can rupture. So think back, what is going on? We have these ulcers in this lining, and over time when these ulcers form, it could lead to a small hole developing in that large intestine, which will cause contents that's in that large intestine to leak into the abdomen, which is not good, because what is in that large intestine? Nasty bacteria, the blood, and the pus, and that is not meant to be in your abdominal cavity. So whenever that spills into the cavity, it's called peritonitis, and as we learned in the appendicitis video, which can happen with appendicitis, this can lead to septic shock and death. So very dangerous situation. Another complication of this condition is called toxic megacolon, and this tends to happen with the patients who have the pancolitis, where the ulcerative colitis is everywhere in the large intestine. And what's happening with this is that there's overwhelming inflammation that dilates that colon, and the colon is not meant to be dilated. And whenever that happens, it can't work. It just literally becomes paralyzed, and then it can end up rupturing, which this is a dangerous situation and the patient can die. Another complication of ulcerative colitis is that it puts the patient at risk for colon cancer, so they need regular screenings with this. Okay, let's talk about how it's diagnosed and the treatment, because as a nurse you need to be familiar with this, because you may be sending your patients for this and you need to be able to explain what it is and have a basic idea. One way it's diagnosed is with a colonoscopy, which is where they take a scope and they go in through the colon and they examine it and look at it and see what's going on. Another thing they can do is called the barium enema, and it's an x-ray used to assess the colon. And an enema of contrast is given through the rectum, enters into the colon, and whenever they take x-ray pictures, it will light up that colon's anatomy, and they can look and they can see what's all going on and where all that ulcerative colitis is at. So what are some treatments for this condition? Okay, one treatment, if it's really, really severe, the patient can have surgery, and there's a couple different types of surgeries. One is called a proctocolectomy, and let the name help you. It's the removal of the colon and the rectum, and they'll go in, they'll remove all of this. Now, because they've removed that, the patient has to be able to get rid of stool some way. So they will have what's called a permanent ileostomy, which they'll have a stoma that will come through to the surface of the abdomen, and it'll set about right there on the abdomen, and that is where they will release the stool. And I did a whole video series on ostomies, so cards should be popping up if you want to access those and watch those to help you review for NCLEX. Another type of surgery is called an ileoanal anastomosis, which is also known as a J-pouch surgery, and it's just what the name says it is. It's going to remove the colon and rectum, but a pouch is going to be created. So you have your colon and your rectum removed, and there's going to be a pouch created that will attach to the ileum, so about right there, and that pouch will allow stool to pass from the small intestine to the anus, so the patient won't need that permanent ostomy where they will release stool through that. Instead, they'll release it through the anus. Another treatment is through medications, which we're going to cover here in a second in depth, what you need to know as the nurse, and diet management. Now let's talk about the nursing interventions that you will be doing for this patient who has ulcerative colitis. Okay, first thing you want to do is, of course, you want to monitor the vital signs, because this patient is at risk for peritonitis or toxic megacolon. So we want to make sure bowels haven't ruptured, it's leaking its contents into the abdominal cavity. So we're going to be watching that. Also, we're going to be assessing their bowel movements, asking the patient, how many times have you went? And you're going to need to look at it. How much blood is in there? Are they losing too much blood? have mucus and pus, and bowel sounds. You're going to be listening to their bowel sounds. Are they hyperactive or hypoactive? And you'll be palpating on the abdomen. Is it really tender? And things like that. And you're going to be doing that focused GI assessment because, again, you're looking for those complications. And some complication signs and symptoms that could represent peritonitis or toxic megacolon. You need to be watching for abdominal tenderness or extreme pain, extreme bloating of the abdomen, fever, increased heart rate, increased respirations. Or are those bowel sounds gone all of a sudden? Are they very hypoactive or are they silent? That is not good. Could represent a toxic megacolon. Also, you'll be keeping the patient nothing by mouth usually, and they'll have some IV fluids running to maintain hydration per whatever the doctor orders. And once their signs and symptoms start to go down, you can start them on clears and then move to fulls and then move to solids. Now, as a nurse, you'll want to be providing the patient with some diet education because remember, as we learned at the beginning of the lecture, certain foods can trigger this ulcerative colitis to flare up, to come out again. And whenever they're actually having a flare up, they need to know some foods to avoid as well. Okay, so some foods they want to avoid are high fiber foods because why? Whenever you look on a test and you see options, ask yourself, okay, this patient has ulcerative colitis. We don't want to give them something that's going to be hard on their digestive system and make it have to overwork. We want to give them something that's easy to digest. So pick the options that would be hard to digest, like high fiber foods, because it requires a lot of digestion. Hard to digest foods like nuts, popcorn, corn, raw fruits and vegetables with the skin. Now, if it's cooked and the skin is removed, they could probably have that because cooking it messes up, decreases the fiber, and makes it softer and easier to eat. Also, foods that are dairy can cause this, spicy or high-fat foods. So they'll want to avoid that. Next, they'll want to eat foods that are low in fiber, so low residue, easy to digest, and that are high in protein. And make sure that they stay hydrated. Also, you'll want to tell the patient to get regular colon cancer screenings because it's super important because they're at risk for that with this condition. And if your patient went for surgery and they came back with an ostomy, you need to know about ostomy care, what your role is as a nurse pre-op and post-op, and changing that pouch and everything like that. And I highly recommend you watch my video on ostomy care because I covered that in great detail. And ulcerative colitis and ostomy care really go hand in hand because a lot of those patients have ileostomies. Okay, so let's look at the medications. What do you need to know as a nurse taking care of a patient with ulcerative colitis? You need to know types of medications they'll be on and some things that go along with those medications. Okay, so the goal of medications are to control those flare-ups and maintain remission. Now, therapy depends on the severity of the case, of what the patient has. If they have a real severe case of ulcerative colitis, they're going to be on a very strong drug regimen. If they have a mild case, they'll probably be on like the aminosalicylates. So, moderate to severe cases will be on a combination of drugs compared to if they had mild. So let's start with the first category of drugs called the anti-inflammatory. What's going on in this condition? Inflammation. So we want to decrease inflammation. That's what these drugs will do. First category drugs are called the aminosalicylates. A popular drug used in this is called sulfasalazine, and this is usually the first line treatment for a patient who has mild to moderate case of ulcerative colitis. However, they can't take it if they're allergic to sulfa, and if this drug doesn't work, they will be started on corticosteroids instead. So that's our next anti-inflammatory, a corticosteroid. Popular one, prednisone. Now, corticosteroids, as we've learned in our whole endocrine series, you don't use them for long term usually. You have to be tapered off of them and then you be put back on them because they have really bad side effects like high glucose, make you hyperglycemic, thinning of skin, bruising, and osteoporosis. And they increase your risk for infection and all those things. So if a patient's on those, you need to tell them that they have to take it as prescribed. Don't just stop in the middle of it because it can cause some major issues. Now, another group of category of drugs is called the immunosuppressors or the immunomodulators. And these drugs are very strong drugs. They have some not so good side effects, and they're usually the last resort that a doctor will order for a patient because the patient has a very severe case of ulcerative colitis. And usually all these other medications haven't worked, or they've been on the steroids, they're having nasty side effects, they need to get off of it, so they start these, or they use these in combination with the steroids. So let's talk about the immunosuppressors first. Popular one is azathioprine, also called Imuran. What does this do? Just like the name says it does. It suppresses the immune system so the body isn't inflamed, gives the gut a time to rest, time to heal from those ulcers. However, this can have an effect on your liver and your pancreas, so you need to watch those enzymes, and there is a high risk of a patient developing cancer with this drug because our immune system fights cancer and fights those crazy cells, and if we're suppressing it, it can't do its job, so there's a risk of that and a risk of infection. One thing you want to remember with both of these, the suppressors and modulators, because we're suppressing the immune system, they can receive no live vaccinations. So if the patient's on this and someone comes and writes an order for a live vaccine because they see that the patient needs their MMR, they need their varicella or shingles vaccine or something like that, they cannot take that while they're on these medications. Now let's talk about the immunomodulators. Popular drug for this is called Humira or adalimumab, and these medications suppress the immune system, but in a unique way. They're called TNF blockers, tumor necrosis factor blockers. So they block that protein that plays a role in inflammation. And it does that so you have a decreased immune system. However, again, the patient is at risk for developing a rare form of cancer. They're also at risk for infection. Now, whenever a patient is started on Humira, before they're started on it, the doctor will most likely check for tuberculosis because this drug can reactivate a previous tuberculosis infection and increases the risk of developing it because the immune system is so suppressed. So they'll want to check them out, make sure they don't have it or have ever had it. Other medications that are used to treat ulcerative colitis are like antibiotics because they have infection going on with those ulcers. That's just a beautiful site for infection to happen. So prevent or treat the infection like Cipro. Anti-diarrheal medications because these patients are having frequent bowel movements. Imodium, however, patients need to use these sparingly because they can cause toxic megacolon. And pain relief due to all the abdominal pain and everything going on. They do not need to take NSAIDs because remember from the beginning of the lecture, this can cause a flare-up, and just how NSAIDs work, it can cause worse ulcering in the digestive system. So it's better to use Tylenol or something similar to Tylenol. Okay, so that wraps up this lecture on ulcerative colitis. Thank you so much for watching. Don't forget to take the free quiz and to subscribe to our channel for more videos.